In 2025. Lots of changes coming around. I've talked about this several times. I've done a live Q&A pretty much every day for the past 3 months on all things Social Security, retirement, disability, survivor benefits, spouse benefits, Medicare, Medicaid. But today's focus will be on Medicare specifically. But as usual, as soon as I finish talking about that, then I'm going to open it up to the floor for all y'all to ask any questions you want me to answer about all those based on my decades of inside experience inside the bureaucratic beast. So let's make sure you're getting all the benefits you're entitled to. If you're watching this in a later and a recording, you can click on the link in the descriptions for other help, a private call with me if you don't want to ask a question during the live Q&A. If you need help with Medicare or Obamacare or anything like that, just make sure you click on that Get Help link, and we can see if we can help you out with your issues. Make sure you and your family are receiving everything they're entitled to. Okay, let me get everything set up here. All right, so Medicare 2025 and beyond. This is, particularly in terms of Medicare Advantage, there's changes to original Medicare, Part A and Part B, particularly Part D, the prescription drug plan. Medicare supplement plans, those are the ones, the 10 plans that, the letter plans, the ones nowadays are, Plan N and G. Those stay the same. Prices are going to go up. They're probably going to announce the price, increases towards the end of the year from your insurance companies. So if you're looking to, if you're G or N, prices go up, make sure you reach out to your agent or broker, or you can reach out to us and we can see if we can find you a cheaper plan, switch you from a G to an N, or maybe an N to a G. Most people are going from G to an N to save some money. All right. But Medicare Advantage, that's going to be a lot of changes. And again, Medicare Advantage, most Medicare Advantage plans come bundled with a Part D prescription drug plan, and there's a lot of changes on that. One of the big changes is CMS, the Center for Medicare and Medicaid Services, Medicare, is reducing the repayments, the rates they are paying these Medicare insurance companies, the Medicare Advantage companies, the big ones out there. I always try to avoid mentioning particular company names, but the big, 4 or 5 or 6 companies out there, the multi-billion-dollar companies, they're getting their benefit, their rates reduced. All right, and because of that, you've got already. A couple of these big giant companies have already announced, probably seen in the newspaper, that they have announced that they're going to cuts in the sense of cut back benefits, cut back those supplemental benefits, the dental, vision, hearing, gym membership, and all that other kind of stuff on their particular plans throughout the country. They're going to be pulling out of some areas that they're not profitable, usually not the big cities. They're probably the rural areas, out in the desert, out in the country, that the population density isn't enough where they're making enough money, so they're pulling out of those particular areas. You'll know all about this. CMS requires these companies to send out an ANOC, an annual notice of change, in September. So the annual notice of change is when you will get the final announcement of what changes your particular company, your particular plan will experience in 2025. But I just want to give you a heads up. This is something you definitely need to prepare for, particularly if you're looking for some type of health procedure this year, or you might want to get it, while the getting's good, possibly. Definitely take that into consideration. So they're going to be reducing those benefits, cutting back, increasing co-pays on some. So there's going to be a lot of changes. And we'll go into exactly why, what's going on here with the industry. This is, as I've mentioned in some of my other videos, in this annual enrollment period, at the end of this year, October, November, December, this is the most important time in the last decade or two, probably, to make sure you've checked your Medicare Advantage plan. And the problem is people Say, well, I've had the same plan for years and I'm happy with it. Well, that's the second part. Great. The first part is incorrect. All Medicare Advantage plans are only good for 1 year. You might have the same company and the same card or something like that, but the details of that plan change every single year. That's why you get the notice of change in September. It says, hey, next year, we're going to charge you more for MRIs or more for doctors or pre-authorizations. You have to do this, that, or the other, or prescription drugs to this tier or this tier, this other tier, and co-payments and deductibles and all that kind of stuff. And maybe you've been healthy up until now and you really haven't noticed it, and still zero premium, still got your same doctor. So you just let it ride. But this is the year that you really, really shouldn't let it ride. You should definitely review your plan, and the new plans come out October 1st. You can start making changes October 15th, and you have until December 7th to finalize your changes. And it all takes effect January 1st. All right, some of the things that are happening is Part D, the prescription drug plan. This is a good thing. This year, there is no donut hole anymore. The donut hole is pretty much gone. There was a catastrophic. So if you had really, really expensive medications, the max out of pocket you would pay is $8,000 this year. Next year, it will be $2,000. So it's reduced, and which is good for people that are paying for very, very expensive medications. But insurance companies now can't charge that other $6,000 to those people. So they are a profit-driven entity. And so they're going to look for that money elsewhere, and gym membership, or changing the deductibles on prescriptions, or charging more for MRIs or CT scans or whatever the case may be, or doctors. So they're going to look for that money somewhere else. Another thing that's happening is CMS has mandated mid-year benefit notification letters or emails. Not sure if they determine when it's going to be email or letter, probably a letter. And it's basically Medicare, the government pays these Medicare insurance companies for all these extra benefits, hearing, vision, gym membership, and, dental and all that kind of stuff. But a lot of people don't use those extra benefits, those supplemental benefits. And government say, wait a second, we're kind of paying you for these extra benefits, but people aren't using them. Are you making it too difficult for them to use it? Are your networks so small? Are you just not notifying people? And so starting next year, you'll receive a letter in the mail that says, from your company, that says, hey, for instance, you have $3,000 of dental and we noticed you haven't used any of it. Just kind of, letting you know that you have that money. And I've done a video on this. This is your money. These companies are not just super, super nice. Wow, it's really my company, XYZ, is super nice. They're giving me all this money for dental and gym membership and yada, yada, yada. No. All those decades you worked and paid into FICA. FICA includes Social Security and Medicare. So you paid for Medicare, for what you're getting right now, for decades and decades and decades when you worked. And all that money is sitting in Washington, or chock full of canned nuts out in back of the White House or Fort Knox or wherever it is. And when you sign up for Medicare Advantage XYZ company, that company takes their little cup, and they go to Washington and say, hey, we just signed up Jane Smith in Topeka, Kansas. Give us her money. And that's how those rates that Medicare pays. It says, okay, you're taking care of Jane Smith, so we'll give you her FICA money. So this is your money. So this is how you get that money back. I did a video a little while ago, how to get your money back from Medicare. Well, this is how you get it back. That's your money. So if you've got $3,000 of the dental that the company's offering you, please use that $3,000 of the dental. And if you're like, well, I don't need $3,000 of the dental, then find a plan that has something you do need. It says, okay, well, why do I have this plan when it's got a bunch of dental and I don't need dental? I should find a plan that maybe is less per day for hospital, just in case I ever have to go to the hospital. My dental plan is charged $300 a day for hospital, but this other one with not great dental only charges $50 a day for a hospital stay. Maybe I should switch to that one. Obviously, most important considerations It has the doctors. The plan has the doctors, which are always changing, and your prescriptions. Your prescriptions are in that particular company's that plan's formulary. And companies, XYZ Medicare Advantage company, they have multiple plans in your area, probably almost guaranteed. Um, and so people say, I love my company, and it's the same. I've had the same company and I had the same doctor and zero premium. Everything's perfect. That's exactly what the Medicare insurance companies want you to do, is let it ride, because you probably have XYZ Medicare Advantage 1.0 that you've had, for 1 or 2 or 3 years. Um, the, the and the underlying details have changed, and they've downgraded and downgraded and downgraded, and they've tried to get new clients by offering your plan, but a 2.0 or a 3.0 or 4.0, and you're driving around, sorry, in the 1970 Chevelle. I used to have a 1970 Chevelle, so I'm not talking about Civic shells, but you could have the new Corvette Z, right? For the same exact price, zero premium. So make sure you check your plan. Long story short, super long story short, right? Adjusting star ratings. So each of these Medicare Advantage plans are giving star ratings, and the companies get little bonuses for having more star rating, customer service, and all this other kind of stuff. Their CMS is making it more difficult to get star ratings, and therefore companies are going to get less bonuses because of that. So CMS has also come down, and for agents and brokers. So one thing also you should check out and be careful of is agents. It's called thing captive agents, and they work for one company. It's like the old Henry Ford. You can have any color car you want as long as it's black. Same thing with captive agents. If you call XYZ Health Medicare insurance company and ask them which plan is the best, guess which one they're going to tell you is their company. I always recommend brokers. Brokers are contracted with several companies in your area, so they don't have skin in the game necessarily, and so they work for you. But up until now, they have had a little skin in the game. Some of the larger companies have been offering people, agents, brokers, more money, little bonuses and stuff like that to steer people from one to another, which is that's completely wrong. If the particular plan in your area is not appropriate for you, then then it's not appropriate for you. But unfortunately, some unscrupulous people out there, so I say, well, I can make an extra $50, $100 here by, steering them to this other one. CMS has come down and said, no, you can't do that. However, last week, a court in Texas decided to put a stop to that. And based on the new Supreme Court ruling, then so that might go out the door. So be careful. CMS tried to stop that steering, but based on this new Supreme Court ruling and a Texas judge, they decided that no, CMS is doing too much, I guess. I'm not sure. I'll keep an eye on that case and let you know. So when you talk to your broker, say, hey, is there any other plans? Again, doctors, your prescriptions, and then what you need. Do you need more dental? Do you need more vision? Do you cheaper prices for CR, for CT scan, MRI, hospital, whatever the case may be. So, make sure if there's some plans in your area that are not good, sometimes brokers, because there's dozens and dozens of companies probably in your area, and some of them are just not very good. So there's that too. So there's also going to be improved access to behavioral and mental health and family and marriage therapy, which is a good thing. But these are going to cost the insurance companies more, so they are passing those costs on to everybody. One thing that the Texas judge, the insurance companies tried to get this Texas judge to throw out the kind of the anti-steering thing, which he looks like he has or will, or at least he put an injunction. He stopped it temporarily. But another thing they said, hey, we should. CMS also said, hey, these agents, brokers, and health insurance companies shouldn't be. If you contact them, you press the little button in Facebook and says, hey, contact me about my Medicare Advantage plan, and they contact you and they don't sell you, they often sell your information to other agents or, internationally, it seems, call centers throughout the country. And everybody calls you. That's why you get 30 or 40, 50 calls a day. And CMS said, no, you can't resell information like that. You have to have a one-on-one. So with the people I work with, the brokers I work with, Medicare insurance, we don't call you. If you don't call us, if you don't click that little button down there, it says, hey, Ed, have your people call me up and let's look over our plan. And if you click on that little button where it says get help, you click on the little I need help with one-on-one Medicare help. There's a little button in there that says, hey, I'm good now, but put me on your list for October. And then just click that, and then we'll call you in October when the new plans come out and compare what you got now or what your plan will be in 2025 compared to all the other plans in your area, and give you all your options. But yeah, so the Texas judge didn't throw out the reselling of the information. So it looks like he kept that one in place. So hopefully those Medicare calls will go down in the future. Yeah, people get 30 or 40 of those Medicare calls a day. All right, so those are all the big changes. And any other changes, there's going to be a lot more changes going forward with the new Supreme Court ruling, the Chevron case. So I will, as usual, keep you updated and make sure you know exactly how to take care of you and your family. All right, let's go ahead and open it up to any and all questions. All right, let's see. Approved for SSDI in 2024. They are paying me wrong amount. February 2024 in front of a judge, and was approved. Back pay and monthly amount wrong by a lot. They said it was something to do with state disability. Yeah, workers' comp public disability benefits, that will affect your Social Security disability benefits. If you receive like a long-term disability or short-term disability from a private company, it won't affect SSDI, it won't affect your Social Security benefits. But a public workers' comp type of thing will, because Congress decided several years ago that people shouldn't make more money on disability than they actually made when they were working. So there's a cap, 80% cap. So that might be why your benefit is reduced, because of that workers' comp public disability benefit. So make sure you check it out. Dr. Ed, I need your help. I was on Medicare for disability until I was 63. Then it was canceled for non-payment during COVID. Yeah, then the only thing you can do is sign up during the general enrollment period, January to March. And they changed the law a couple of years ago that before you had to wait until July till your Medicare started. But now, if you sign up in January, your Medicare starts in February. And then in February, because you'll be essentially kind of new to be, you can sign up for a Medicare Advantage plan at that time. So yeah, reach out to us and we will help you out. Let's see, Rosa. Hi, I'm applying for early retirement due to back injury. There's a question in the application. Okay, let's see. See if there's a second part. Oh, okay, here we go. Back injury. There's a question about receiving more money from last employer. I'll be receiving a vocational training buyout. Do I have to report that? Basically what it is because you are filing for early retirement, you have to limit your income to the $22,320. So it's just telling the system, MCS, and there's a non-service months, and I've done 100,000 of these applications. Basically what it is that there is a monthly test the first year. So if you work from January to July and you make $1 billion, but you start your Social Security benefits in August, Social Security doesn't care what you made before you started your benefits. So that $1 billion, they don't care in terms of the annual earnings limit. Starting in August, you have to stay under the monthly limit. $22,320 divided by 12 months is $1,860. So as long as you stay under $1,860 from August going forward, you're good. That question is saying, that, okay, you're saying that you're not going to work over 1860, but are you going to get any more money? So, but if that money comes from, your employer, owed you, annual leave or some type of settlement or something like that, it wasn't for work you did starting August. That's just kind of to identify that extra money coming in. So if you don't, if you stop working, you no longer work in August, but all of a sudden you get a check for $10,000, the Social Security system is going to have a little red flag there and say, wait a second, you got $10,000, you're working, so we're going to stop your benefits for that month. But if you put in there that, yeah, I'm going to get some money, but it's going to be for a previous time frame. So um, that's just that. So that's the reality. The explanation. Is it better to review with one of your brokers than with an AARP advocate? If you, whoever you're comfortable with, someone local, someone you know and trust, family member, or whatever the case may be. But we are here if you need us. Let's see. Okay. Okay, about the same thing. 20 to $25, that is not going to help at all, and that's the high end. Not sure what is that a follow-up on another question? Currently receiving SSDI for military injury. The VA has classified me as legally blind. Is there any additional benefits? Um, Um, Not necessarily. Depends, once you get SSDI, with legally blind, you've got different work limitations. But in terms of SSDI and visibility issues, yeah, there's no extra benefits other than just straight SSDI. And then you probably don't qualify for SSI because you're already getting a VA benefit and all that other kind of stuff. But and then once you're on SSDI for 2 years, you're going to get Medicare, but you already have probably VA type stuff. And then, but I would recommend maybe a Medicare Advantage, one of the Part B gives back, so you can get your Part B, have your cake and eat it too, and get a Medicare Advantage Part B give back where they pay part of your Part B premium. So when you get your Medicare started, reach out to us if you want, and we can help you out. Social Security cut my check back $350. I'm 74 years old. Huh. Why did they say they cut it back? Um, is the only extra Part B premium, perhaps? You sold a house a couple of years ago. Um, Those companies like to make you think you're getting all the bells and whistles and won't explain where your extra coverage is when they deny you for, yeah, if they don't have in doc, you can see. Yeah, the CMS is always trying to rein, health insurance companies in and, tell them not to deny people and delay all this kind of stuff. But now, based on the Supreme Court ruling, unfortunately, yeah, it's a new era. And CMS, unfortunately, won't have the authority, the power they did before. So insurance companies, I'm afraid, they're just gonna, like that Texas judge, they're just gonna go find a judge somewhere in the country that's, they like and that they've got into office, and sue, and the company will, or the judge will side with the health insurance company, and that's how regulations are going to be made from now on. So yeah, yeah, I'm very optimistic, but I'm a general an optimistic guy, but yeah, not in this case, unfortunately. I've also a student of American history, and I've, yeah, studied the Gilded Age quite a bit. This question is from a friend. He found out yesterday that his Medicare Advantage was canceled the same day he enrolled in January due to a Medicare issue he had on regular Medicare. Um, yeah, if the only way the Medicare Advantage could be canceled is if you don't have Medicare Part B, or Part A, but usually it's Part B. So if he lost Part B, then yeah, Medicare Advantage would cancel him. Or if he moved and the plan is no longer in his new area, then yeah. So tell him to let me uh, put that down there again. So click on that and click on the one-on-one Medicare help, and can have someone reach out to you and or reach out to him, have him fill that out. That's another good thing is CMS um, for Medicare insurance brokers and agents. The regulations are just crazy. So, like for instance, she was talking about her friend Dan, and and if she said, "Hey, here's his number. Go ahead and call him up." A Medicare insurance person can't call him because that person Dan has to call directly, reach out, email, texts, carrier pigeon, whatever the case may be, has to contact the Medicare insurance person directly. And then once they do, then, now, all bets are off. But yeah, Cynthia can't say, here's his information, call it. You can't do that. I'm sure some Medicare insurance agents and brokers do, but they're not supposed to. That's how strict Medicare CMS regulations are on that type of stuff, which is good. Even when you go into a Walmart or someplace and you see that, ask me about Medicare table. You ever notice they don't make eye contact and they don't say, hey, come on over and stuff like, because they're not supposed to. They can't say anything until you say something to them. So that's why they, ask me, please talk to me. I'm a human being. Talk to me. Yeah, because of the CMS regulations. But that's a CMS regulation, and CMS, maybe can't make that decision anymore. Some court will. So it might be all bets off. And now when you go in that Walmart, they're going to be jumping all over you. So, um, advice from a former insurance claims processor: appeal all denials. I like it. Yes. Same thing with me. Advice from a former Social Security manager: appeal all denials. Yes, we're on the same page. Thank you, Auntie Ree. April, thank you. He just signed us up for Medicare plan yesterday, and I will begin August 1st. Awesome. Good deal. Good deal. Your people helped me. Oh, okay. God, awesome. Good deal. I like it. My Medicare Advantage plan costs $26 per month in premiums and provides $600 yearly debit card, which can use for dental care and over-the-counter Medicare. Easy to use it up by the end of the year. Good deal. Yeah, if it's $600 a year for dental and all that kind of stuff, OTC, yeah, that's a pretty good plan. $26 a month for a premium. Usually something like that would be zero, but yeah, that's a good deal. But remember, that plan goes away like Cinderella midnight on December 31st. And hopefully it gets better, or it might get worse for 2025. So that's why it's important to double check. If at all is possible, stay away from Medicare Advantage. It's garbage insurance. Original Medicare is far better. As John probably knows, I always recommend Medicare supplements first because I just don't like the networks and pre-authorizations. I don't want some Medicare insurance accountant, get involved in the decision between me and my doctor. But as John knows, the reality is a lot of people just can't afford the Medicare Part B premium, the $174 plus $80, $100, $120 for a Medicare supplement plan. And we also understand that if you actually get sick, you might actually be saving money paying that monthly premium. But unfortunately, people just can't afford a Medicare Advantage. But I'm just kind of to kind of look at the crystal ball in the future. Right now, this year is American history. More people are turning 65 this year than any time in U.S. history. And I'm just worried whether these Medicare Advantage plans are giving all these extra benefits and zero premium and get you sucked in there. Because once you're in there, it's very difficult to switch to a Medicare supplement. So over 51% of people have Medicare Advantage plans that have original Medicare, have chosen the Medicare Advantage route. And so there's all these attractive zero premiums and gym memberships and gift cards and all this kind of stuff. And are they, bringing us in and then 2 years, 3 years, 5 years, 10 years, when they've got their captive market in there, then yeah, zero premium, nice try. $80 premium, $100 premium. And then you say, wow, I should have done a Medicare supplement. I'll switch to a Medicare supplement. No, unfortunately. If you're very, very healthy, you can. But after your original enrollment period, which is 65 years old, or if you're new to Medicare Part B, after that time, most times you can only get into a Medicare supplement with health underwriting. It's about 30 or 40 questions they ask you. So if you're not healthy, then you're essentially stuck with a Medicare Advantage plan. So yeah, John, the Medicare Advantage plans are very good now, but that's the issue. Particularly in Florida. In Florida, some of the best plans in the country are in Florida. Yeah, unless you get sick with those pre-authorizations and all that. But I hope I'm wrong. I certainly hope I'm wrong. I have been wrong before. Thank you for the information and knowledge. What happens to CCRS money that my first husband had that I couldn't get? Does it go to SSA for the disabled? I received my second home. Yeah, all that money goes into the trust fund. It goes to surviving children and disabled children, and all the rest of it. Yep. 2025 is going to be a on plan changes. May the odds ever be in our favor. Yeah, it's gonna be interesting. And unfortunately, there are just some people that just want to let it ride, or they just say, I'm happy, and or they don't do it before December 7th, and you just delay it, delay it, delay it. That's why I get to your broker or agent and say, hey, put me on your list, or click on the link down there and we'll put you on our list and remind you, hey, you've got other things in life. We'll help you with the Medicare Advantage, review. Or, if you don't, then next year, if you get sick or fall, you go into the hospital, and, that $100 day is now $500 a day, and the MRI is no longer $75. It's, $400. So, and your prescription terms from this, and it was tier 1, and it was a generic, but now there's a deductible, and so your prescriptions go up, and so yeah, it's not going to be fun. Let me see here. Military veteran, SSDI for 8 years. The VA has now classified me legally blind, which is a new disability. Can I get additional money? Yeah, I think the same question just had there on that. Yeah, if you're already on SSDI, you've got more ability to work, but you don't necessarily make more money. Was only on workers' comp for 6 weeks, and it was way before SSDI. Why would that reduce SSDI now, years later? Oh, okay. So yeah, if then that won't be why your benefit was affected there. I just, just kind of spitball in there in terms of, but if you took some people say, well, I've got a workers' comp or public disability, and I'll just go ahead and take a lump sum, and that way it won't affect my Social Security disability. Kind of nice try. What they do is they amortize that lump sum over your longevities, and then they take that deduction there. So if you took a lump sum, even if it was only for 6 weeks, you took it for 4 or 5 weeks and then just took out the lump sum, then that might still count against you. But that doesn't sound like that's it either. So just I would reach out to them and find out, hey, what happened to the other 350? I think that's what she said, 350. Just to clarify my previous question, I am 7 years older than my ex-spouse. If I want to take 50% of his, I must wait until I'm 69. He will be 62. Thanks. Okay, let me put this in my brain here. So you're 7 years older. So from ex-spouse, as soon as your ex-spouse is 62, you can file for benefits, regardless if that person has filed for benefits yet. It's called the independently entitled divorced spouse. So if you are your full retirement age at that time, so you'll be 69 at that time, um, yeah, then you will get 50% because you will be your full retirement age. David, I have Tricare from the military. When I turn 65, I will go on Medicare and have to get a plan B, and the military will give me Tricare for life. What would be a better plan advantage or other? You really don't need to do anything. Some people that have Tricare get like a Medicare Advantage so they can pay for part of the Part B and maybe get a gym membership or some extra dental or have an option to get a second opinion outside of the system. But some people don't. So if you do, there is if you have to go to the hospital or something like that outside of then there's a little couple extra paperwork thing, bureaucratic thing that TRICARE and billing, first biller, second biller type stuff. So some people it's like, hey, I'll pay for that extra for a little bit extra, So so you don't have to, but yeah, Medicare Advantage. I would definitely not get a Medicare supplement. Definitely not yeah, you don't need to pay $80, $100, $150, whatever for a Medicare supplement because it's just too much insurance. You don't need it. Medicare Advantage, the zero premium plans or a zero premium plan and one of the plans that pay for your Part B premium is probably your best option, but you don't really have to if you don't want to. Thanks. Sorry, I'm confused. The dollar will be from a vacay buyout, not earned wages. Do I report it or not? Vocational buyout. Um, yeah, I would put it down there. That way, it flags the system. Yeah, just go ahead and put it down there because the question is, are you going to receive any more money after you start receiving Social Security? And that sounds like more money after you receive Social Security. So I'd put it down there just in case. But just say, hey, it's from a previous period. And if it comes up, because the social, regardless of what you do, the Social Security computer system is probably going to mess it up. So just expect that because the system I know is not that intelligent in that respect, the monthly, but it's really easy to fix. So whatever you put, anticipate there's probably a 25% chance it's going to get messed up. But it's easy to fix. So next year, when you do your taxes and you notify the IRS how much you made, and the IRS notifies Social Security, and Social Security sends you a nasty gram that says, hey, you said you stopped working in August, but you got X amount of money. And then you just take what you have and go down there and go, oh, okay, all right, no problem. And it'll be taken care of. So regardless of what you put down there, probably anticipate having to do that. But it's super, super easy to fix. Um, does a person collecting SSI pay taxes like a person collecting? Yeah, I don't do taxes. When does Medicare or medical start to contact you about applying? I'm not 65 years yet. They don't. You have to contact them. So if you are approaching 65 years old and you don't have health insurance from work, yours or your spouse's work, and your employer, if your employer has 20 or more employees, you don't have to sign up for Medicare if you don't want to. But if you don't have health insurance from work and you want to go ahead and sign up for Medicare, then about 3 months before you hit 65, then contact Social Security, go online, schedule an appointment. If you're currently receiving monthly Social Security benefits, then you don't have to do anything. It'll be automatic. If you're currently receiving Social Security benefits and you're approaching 65, then Medicare will automatically send you your Medicare card in the mail about 100 days before. But then you have to decide what you're going to do with all the gaps of original Medicare. Particularly the big one is the Part B 20% co-insurance. So if you have a $100,000 surgery, you have to pay $20,000 of that. That's why people get a Medicare supplement or a Medicare Advantage. So you need to start figuring out which one you want to go with. And I've got a bunch of videos on that, or you can click on the little link and we can have someone reach out to you and go through all your options. That is 100% free. What does the 2025 plan have in store for Social Security? Yeah, I did a video on that a couple of days ago, and that's what kind of scared me is the fact that it didn't talk about Social Security solvency at all. So either they don't think it's a problem, or their solution is so scary that they didn't want to write it in. Yeah, so that's not good. Um, but the same organization did put out, outside of Project 2025, the same organization did put out their ideas, and their ideas are um, full retirement age, increase the retirement age from 67 to 70, and cut benefits and all that other kind of stuff. So, but to be fair, in Project 2025, nothing really about Social Security, solvency, or anything. Does unemployment wages affect you filing for SSDI? No, they do not. Should you wait until unemployment runs out? No, no, no. File, file, file immediately, if not sooner. Run to the phone right now and schedule an appointment, or run to the internet and watch my videos I did on filing for disability, and then file for disability on online, or whatever the case may be. But no, unemployment wages do not affect disability at all. Please, please, please go start the process now, because it's taking anywhere from 6 or 9 months to get a decision. So please get it started. Can you speak on how trusts work to protect home if person goes to nursing home? Yeah, so there's a revocable trust and irrevocable trust, and you can go see a estate planning attorney in your area, and they can help you out. But basically, um, if you go into nursing home and you've got money, you spend all your money, you pay for the nursing home, pay for it, pay for it, pay for it, and then you got no more money. And then Medicaid, the state Medicaid offices pay for your nursing home. And then when you shuffle off your mortal coil, that Medicaid, state Medicaid, comes after your house. Most states, a lot of states are very rambunctious about coming after people's homes. To prevent that, what people are doing is putting their house in an irrevocable trust, uh, and that protects that house. So if you want to give it to your kids or whatever the case may be, but that has to be done 5 years before you kick the bucket, because the Medicaid offices have a 5-year look back. So if you did it 4 years ago and you passed away today, then that didn't help. They can still get it. Under Project 2025, we are going to be forced to Medicare Advantage anyway. Yes, that is correct. Under Project 2025, that 900-page tome, then yes, they recommend Medicare Advantage as a default choice. So you're automatically, not forced, but for all intents and purposes, I guess, you're going to be automatically put into a Medicare Advantage plan. And then, yeah, so, and then once you're in a Medicare Advantage plan, then again, it's very difficult to switch. Depending on your situation, it's often difficult to switch to a Medicare supplement plan. So they got you kind of trapped. Yeah. I'm on SSDI, 57 years old. Can I get Medicare supplements instead of Medigap? Those are the same thing. Yeah. So a Medigap, Medicare supplement, is the same thing. Medicare supplement plan NG. It's also called Medigap. But you probably mean, can you get a Medicare supplement instead of a Medicare Advantage? Hopefully that's probably what you mean. And it really depends on your particular states. This is all, this type of insurance is regulated by the state. Almost all insurance is regulated by the state. And if your state doesn't mandate insurance companies to provide Medicare supplements to people under 65, which most states don't, then yeah, the only option you have is Medicare Advantage. And that's usually the case. If you're on disability, the only option you have is the Medicare Advantage. But a lot of people don't realize, when they're on disability and they have Medicare Advantage, when they turn 65, they can switch to a Medicare supplement, and there's no health underwriting. So yeah, so for people on disability approaching 65, then you can switch to a Medicare supplement, and there's no more pre-authorizations or networks. You can go to any doctor in the country that takes Medicare, and you're free. Let's see here. Bridget, a WEP question. 2 retired Texas married teachers receiving pension and Social Security. Husband's Social Security is good, but wife was told she could not have half of her husband's. Is this true? Yes and no. That's not a WEP question. That is a GPO question. WEP is on your own record. So she cannot get half of her husband's because of the government pension offset. It's just the reverse part of the windfall elimination provision. But yes, that unfortunately sounds right. 2/3 of your state teacher's pension, not because you didn't pay into FICA, into Social Security, Texas opted out of that system. Then 2/3 of your non-covered pension affect what you would receive on spouse benefits. So Medicare Advantage, story of my life, dual eligible as a single parent and divorced. Um, yeah, Auntie B, for a Medicare Advantage, I always recommend a Medicare supplement, but if you have Medicare and Medicaid, Medicare Advantage dual eligible is definitely the one to go with. You can't even get a Medicare supplement if you're on Medicaid. But yeah, for Medicare Advantage, I recommend those if you're on Medicare and Medicaid, you're dual eligible. Let's see here. Husband gets long-term disability payments through private company with job. They say his disability will be reduced when he starts getting retirement at SSA at 62. Yeah, that sounds like a private decision by that insurance company. That yeah. So Social Security doesn't care about long-term disability or anything like that for through a private company, so that it doesn't. It's not a Social Security thing. But if he's receiving long-term disability, he should file for disability benefits rather than Social Security retirement. You know, or file both at the same time. I did a video on this called RIB DIB, filing for RIB, retirement insurance benefits, and DIB, disability insurance benefits at the same time. If you need the money, that's why people do that, because it takes 6 to 9 months to get a decision if you're lucky on disability, and some people need that money, while they're waiting, so they get early retirement benefits. But if he is receiving long-term disability, he might not need the money. So, and he's not 62 yet, it sounds like. So, you know, think about filing for disability benefits. If my husband retires and payout for his unused leave causes us to owe Irma, can he successfully appeal on base of retiring? Yeah, that's a life-changing event. Yep. Made $1 billion 2 years ago because he was working, and gets that nice Irma letter that you have to pay whatever extra hundreds of dollars per month. And then you say, yeah, I'm no longer making $1 billion, and Irma goes away. So, yep, easy one. Seniors shouldn't have to go through with this nonsense of Medicare insurance after working for years. I agree. I think there should be like a Medicare Part E or Medicare Part F. We added Part D. It took us forever to get Part D prescription drug, benefits added to original Medicare, which sounds crazy. Then it's like, come on, drugs, it's prescription. But it took us forever, and we finally did it. So I think our next thing is, as I've said many times, we need to add vision, dental, hearing, and get those 6 gaps covered. If we have to do like a national Medicare, supplement plan, X or whatever, where each of us pays another $40 a month and everything else is covered, then we're good. And we go to any doctor we want and all the rest kind of stuff. So, yeah. So hopefully before I move on to the next great beyond, that will take place. But yeah. Don't forget to hit the thumbs up. We want to keep Dr. Ed on YouTube. Thank you very much. I appreciate it. All right. Yes, please. Let's see. Yes, all natural. 162 people watching, 74 likes. Yes, please get the likes up there. If buy a house while on Medicaid dual complete, would this 5-year rule be not applicable? No, if you have a house when you pass, then yeah, the if Medicaid paid out for your nursing home and stuff like that, then yeah, they can. It depends on the state. Some states are, Yeah, they really go after people's homes and estates and stuff like that. But do you know anything about a cancer insurance policy separate from original Medicare and Medicare supposedly picks up cancer treatment and care? Yes, yes, cancer plans, absolutely. There's supplemental plans, there's like a hospital indemnity. So even if you're like Medicare Advantage in your particular area, some of them, they still charge, 3 or 4 or $500 a night, $1,000 a night for a hospital. Some people pick up a relatively inexpensive hospital indemnity plan, which hospital indemnity, um, and that covers that extra. And then there's also cancer plans, and yeah, so um, my team actually has those. So if you're interested in kicking those around, vision, dental plans, cancer, hospital indemnity, and obviously Medicare supplements, Medicare Advantage, even burial insurance. The reason I put a team like that together is because I saw the results over decades of people, being given the wrong information and hard selling and just straight out fraud. And so I just said, then I'm going to put together people that I know are going to do a good job and treat people right, and not enroll them in things that they shouldn't be enrolled in. So I just decided, uh, one of those do it myself type things. But I don't enroll people anymore. I did that for about a year to see how the sausage was made, and yeah, I now this is my full-time thing right now, is to help y'all get your information. SSDI and passive income, stock investment, rental property. How does that work? Yep, doesn't affect anything whatsoever. You're good. Unless, one exceptions, there's always exceptions, exceptions, exceptions with anything government. Rental property, if that's your business and that's, in terms of you are a realtor and that's your job is to rent out homes and stuff like that, then that's your job and you're working, you're self-employed. But if it's just, hey, I have a few houses, and then, it's, you're having a rental income is kind of like your 401k for people that are self-employed, right? If that's just the case, then yeah, it doesn't affect your SSDI at all. It's just, yep, you're good. When you get SSI, what happens to your SSDI if I hadn't been used? Um, yeah, I'm not exactly sure what that means. You can get SSI and SSDI at the same time. So um, if your SSDI, what you paid into FICA taxes, is low, you're only going to get $400, and then you don't have any other income or resources necessarily coming in, then what happens is they give you SSI on top of that. So you get $400 from SSDI. And then if you get the max rate, you get another $543 from SSI. So for a total of $943. So yeah, um, so that might be what you're getting. Medicare Part WTF, maybe. I like it. Yes. It's like, yeah, that's dental, vision, and hearing is like, those are extra benefits in your retirement. You can't see, drink, or hear, and that's some type of extra phenomenal benefits that, and it's like, yeah, that should be WTF. Yes, I agree. Liberty 1776. Oh, I haven't seen y'all in a while. Hey, I'm 64, going to be 65 next year. Currently on Social Security. Does SSA send me a notice of Medicare prior to my 65th birthday? Yep. Yeah, you'll receive your package in the mail about 100 days before. So yep, everything. And just make sure your address is updated with Social Security, because Social Security notifies the Medicare of your address, and they'll send it. And be careful though. Um, Everybody in the country, as I'm sure you already know, everybody out there knows that they know you're turning 65, and they want to take you to the turning 65 Medicare dance. You're now the new homecoming king, queen, and everybody wants to take you to the dance. So you're receiving tons of mails and emails and phone calls. So what happens sometimes is people get so inundated with junk mail that they throw away their Medicare package, the actual Medicare package. A lot of these companies, send out stuff that looks like official Medicare, but it's not. And so some people throw away their card, and it's like 3 months later, it's like, they forget to pay, or, whatever the case may be. So make sure, make sure you watch out for it. And then obviously start thinking of what you're going to do. Medicare supplements, Medicare Advantage, and all that kind of good stuff. So I'm waiting on approval of Medicare assistance plan with DHHR. I must be enrolled in Medicare by August 1st. What do I do if not approved for dual eligibility plan by then? Yeah, that's always a sticky one. Please, reach out to a broker agent that you know and trust. If not, reach out to us. My team is licensed and contracted in 50 states. Sometimes what you have to do, unfortunately, is just go ahead and get in a regular Medicare Advantage plan, and then a month later switch over once they approve your Medicaid. Because there's also, in Medicaid, depending on the state, there are different levels. So if you get like a QMB, qualified Medicare beneficiary, a QI, qualified individual, SLIMB, there's a few categories that will get you a dual eligible plan. But if they approve you for Medicaid at a lower level, then you wouldn't be able to get a Medicare Advantage plan. So it really depends on your particular state and how they categorize you. But sometimes, unfortunately, you have to enroll in a plan, and it's a zero premium, so it's not going to cost you anything. So you roll in a plan and then you get approved. It usually happens like 5 days later. You finally receive the mail that, oh, you're approved. And then you just call the broker back and say, yeah, I got approved. Let's switch the plan again, starting, first of next month. And then it's zero premium. It's just not going to cost you any extra money. It's an annoying bureaucratic hurdle you have to go through. So, although healthy now, would like to get cancer plan or indemnity, like you said. Thanks so much. Yes. That's the insurance. If you get it when you're not healthy, then you usually can't get it. Yeah, so now's the time to get it. Absolutely. Will the SSA and Medicaid ever catch up with the times? I don't have to even read the end of that sentence on how much one is allowed to have. It's ridiculously low currently. I agree with you in terms of SSI and Medicaid and $2,000 resources, $3,000 if you're married, and they really need to up those caps a little bit. I agree, because the big issue is affordable housing in this country. That is a humongous issue. People get $1,800 and they can't get Medicaid or anything else because they get $1,800 or $1,900. But that's month of rent and electricity. What am I going to do for food? A friend was told her hearing aids couldn't be replaced because she is dual eligible and Medicaid doesn't believe hearing is necessary. Oh my gosh. Yeah, that's why the dual eligible, you find a dual eligible plan that covers hearing aids. And again, that's how you use these Medicare, insurance companies, Medicare Advantage. Particularly if you have a dual eligible plan, you can switch several times a year. If you have a dual eligible plan, you can switch plans several times a year. If you have the extra help with prescription drugs, you can switch several times a year. When you move, you can switch. There's all special enrollment periods. You find a plan that has the hearing aids, but you're like, well, it doesn't have my doctor. Can you be without your doctor for a few months? Get over to this plan, get your hearing aids, get them all set up, tested, fitted, yada, 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 and then switch back to the plan you like with your doctor. So insurance companies are probably going to, am I buffering yet? They're going to shut down my internet here. I went to Mexico for dental because, well, as you know, dental isn't important to stay healthy. Yeah, there's an entire town there. There was called Dental Street or Dental City or something like that. That's a big thing nowadays is, medical tourism. I'm not going to talk about all the people going to Turkey for hair transplants. Obviously, I haven't been there yet, but maybe. Anyway, if we can get specialists, the quicker we could be helped and off disability. A lot of people, you'd be amazed how many people, don't want to get disability. People think, oh, they're just a bunch of freeloaders and stuff. I've taken, hundreds of thousands of disability claims, and a vast majority of people hated filing for disability. It's like, I made so much more money, when I was working. I really want to. So people say, all these, they're speaking without any experience. There's so many people that would rather work at a job they like. I'm 67 and had to retire because of Parkinson's, but I was told I couldn't get disability. True. Yes, unfortunately, there's no more disability benefits after your full retirement age. I just did a video on that a couple days ago. But yeah, once you hit your full retirement age, everybody in the country, so everybody on disability, once they hit their full retirement age, their disability stops and they're switched to regular retirement benefits. Most people don't even know because their check stays the same and everything like that. So let's see. Let's see. I'm still working, but my doc says he recommends SSDI. What do you advise? If you're still working and making over the SGA, which is called the substantial gainful activity, which is $1,550, then no, you cannot file for disability. Once you stay under the $1,550, then yes, apply for disability immediately, if not sooner. Let's see here. What else? SSDI, they pay you from your disability on set date if you worked or not. Okay, I'm not sure if that. Let's see. Don't hate on your hair, doctor. Oh, thank you. Appreciate it. I got it. Yeah, this my my humor there. Got to make fun of it or I'll cry. No, I built a tiny house and now pay $400 a month for a lot rent, but you have to be willing to live with less. Yeah, I grew up in a single wide trailer, 60-foot trailer. Yeah, until it was taken away by Hurricane Andrew in Homestead, Florida. So there's that. All right. All right. We are over an hour, and I think we did pretty good on all your questions today. So if you have any friends or family that have any other questions or need